welcome to another edition of Clock Talk with Dr. Greg Brannon. I am Jim Baker, and today, unfortunately, we're going to talk about another critical topic that I'm quite frankly depressed by, and that's male infertility. So, it seems like we're in an epidemic of obesity, we're in an epidemic of a health crisis in this country. I've been reading a lot that over the last 30 to 40 years, male sperm counts have continued to decline, and now they're declining even more rapidly. What is going on?
I'm going to give you some just numbers upon numbers. I was an OBGYN, did infertility for 30 years. Since 1973 to 2018, sperm count has decreased roughly 50%. Low was roughly 100 million per ml. That was usually real low. Now 47 million is a lower value. It's considered a normal. When it used to be 100 was normal. A normal on the low side. By strict definition, under 20 million may be considered zero. Under 4 million is gone. The generation today, under say 25 years of age, 4 to 10% of all males in North America, Western Europe, New Zealand, and Australia was a study, 4 to 10% are infertile. It's called azoospermia. The numbers are greater. The World Health Organization looked at a paper, did the largest series of studies right here, 57.4% decrease in sperm concentration, 59.2% decrease in total sperm count. MIT and Hebrew University did a study, they think by 2050, men will be infertile. 2050. So
that's the entire population?
Of this is, again, a study out of Western Europe, North America, South America. It's not in South America or Africa right now. So as obviously with food, the chemicals, but the first off is the process, how sperm is made is crucially important.
Let's walk us through that.
Yeah. So in males, you have both men and women use the same thing in the brain. It's called the anterior pituitary. Makes a thing called follicle stimulating hormone. In women, that makes the egg mature. In men, it makes sperm. LH in men makes testosterone. Testosterone converts to estradiol. In women, same thing happens. Estradiol comes from testosterone. In fact, women have 50 times more male hormone than they do estrogen. So that's the phrase, I hate male hormone. It's a human hormone. So, but in men, testosterone becomes estradiol. Then estradiol, the brain makes the FSH, the testosterone estradiol made in the testicle. As the estradiol gets higher, it goes back to the brain. It's called the negative feedback loop and tells the brain we have plenty of testosterone. Testosterone affects every single cell in the body. We're going to affect right now just the gonads, so the spermatogenesis. So what happens is testosterone makes sperm grow, mature, and sperm actually matures out at a lower temperature until our testicles hang out of the body as ovaries are inside the body. So that's how that works. That's how everything works. So what happens is, what if you throw a curveball in the system? Because the body recognizes estrogen. It goes, oh, I have estrogen, therefore I make testosterone, so I'll stop making it. But if you have an outside source of estrogens that your body does not make, but your body recognizes that, they're called estrogen mimickers or xenoestrogens. Other phrases called endocrine disrupting chemicals. It will trick the body. You're hyperestrogenic, then you make less testosterone. It's happening every succeeding generation. That's why the range of sperm and the range of testosterone has decreased, not per age, in the sense that older people are having more and better numbers, older men. It's the younger generation are bombarded in the womb because the major one are these phthalates. What they do is they do a couple of things. They stop the production of testosterone. They increase the enzyme called aromatase, so it makes more of our natural estrogen, and it also mimics estrogen. So it does everything it has to bombard our body in a hyper-estrogenic state. I believe that's probably one of the biggest culprits in this whole thing.
So what are some real-world examples of that?
Pesticides, organic phosphates.
And so you say they're in the womb too. It's just
because
same thing?
Filtered water, just water, food, our processes. The placenta cannot filter these things out. So as the gonads are being developed to testicles or ovaries, they're being bombarded with these chemicals. So actually we're having lower values at the beginning. I mean, we're talking about male fertility, but same thing with women. Fertility rates are increasing, and also increased miscarriage rate because testosterone, iodine, vitamin D, these are crucial for the implantations.
So I think you told me this once, correct me if I'm wrong, but it takes one sperm at what, a 64 degree angle
to horizontal to penetrate. It's called the zona pellucida. So you have all these millions of sperm attacking the ovum. If you see the size difference, the ovary is much bigger than this and that. So roughly, when you look at to actually penetrate that, it's numbers. The sheer numbers are important because you got to get that angle of attack. Once one penetrates, this thing called corona radiata blasts open and stops other ones from penetrating. And every now and then, that's why you have twins or triplets. But that's what it does. So that's why it's a mechanical and a chemical process. But it's exact science to penetrate has the best way to actually penetrate the ovum. So once that happens, then you have the 23 DNA of the male, the 23 DNA of the female forming the male or female XX or XY.
So we talked a lot about numbers, but what about the quality?
That's also decreasing. In fact, they're considering normal now, Jim, anything around 3 to 4% normal shape. So they look at size, they look at shape, they look at movement, they look at all these things. So if you have around 5% normal, that's actually good because again, it's a numbers game. If you have 400 million, and you have 5% are good, it's great. But the problem is having less number and more abnormalities.
So what's one to do?
Oh my gosh, Jim, if I had that answer. But see, I don't believe somebody's sitting there trying to kill us. We don't want to ruin our species. But these things, you don't know these things are happening until multiple generations. Look at thalidomide in the 50s. Okay, look at DES in the 50s and 60s. These medications are given for mommies to help decrease miscarriage. It led to babies with no limbs. It led to mothers who got pregnant now having little girls who now their wombs are abnormal because of DES exposure. Because when a molecule is not exactly the same shape, same structure as the molecule our body makes, it can have some delicious effects. Sometimes beneficial, but it can also have other effects that are not beneficial. So, Jim, again, eating better, grass-fed meat, try to keep the pesticides, organics out, the GMOs out, the plastics out. Those are all things we try to do, right? Anyway. But the big thing is, Jim, it's the numbers are bombarding us. We know they're coming, but there's still, I think what I read, there's over 85,000 new chemicals out in the world since World War II, and they can't be all studied. So you don't wait until that things occur and they build up. But once you see things, Jim, we have to do something to protect our food sources, food and water source. One of the biggest food sources, water sources, when women throw their birth control pills in the water, that extra estrogen gets to the water. Atrazine, which is a pesticide, gets in our water system. These are things that are having Berkey water filters, having a water filter system is very important.
As the male ages, like testosterone tends to decrease, does sperm count decrease as well?
Yes, and this was interesting, Jim. If I had an 80-year-old man come in our office, they could check his testosterone, I could tell you he's 4 times higher than our 25-year-old. Is it crazy? Just the opposite we're taught because you lose with age. No, we don't lose testosterone with age. We lose more exposure to these environments are lowering it. And again, the younger people being hammered from the womb, we were not hammered as much. But you can look at every generation, how they're going down. Again, we know from 1970, there's a paper from 1940 to 1999. They were showing back then a decrease of around 20 to 30% back then. Compounding what we're doing now, it's 2% per year since 2002. So these numbers are astronomical. You start adding these things up. So again, we look at I have all the causes in the BPA, the phthalates, the preferred chemicals. But when you look at these kind of aspect of this, Jim, it's really important on like what we can do. We know omega-3 fatty acids help. We know vitamin D helps. We know iodine helps. We know a protein-based high-fat diet helps. Omega-3 fatty, not omega-6 fatty acids. There are benefits to do, but we got to get the source and get the water and food supply as best we possibly can.
Obviously, you're treating younger males on testosterone due to the fact that they should be a lot higher than they are due to the environmental causes that you just talked about. When they get in a situation where their family, they want to start a family, how do you do that?
Well, how do you help them? Let's go with that. What do people have in their pockets all the time? Cell phones.
Right.
Think about how close that is to your testicles. We have a thing in our body called the voltage gator channel of calcium. Calcium gets you, when you get the EMF exposure, it's this large surge of calcium release. That is because we're basically a battery that blocks communication between our bodies. That's another source of probably decreasing sperm count, decreasing testosterone. So now we have a young man who's in the reproductive age, who wants to have babies but needs testosterone because they come to us because they're tired. They are brain fog, anxiety, depression, belly fat, diabetes. All these things are side effects of low testosterone, which does its function. So some doctors recommend just giving Clomid to young men because it will increase their sperm count, increase their testosterone. I did that for years, but I find the men that are on Clomid works at the brain hypothalamus level, and they have emotional. They're sometimes decreased libido, even though they're higher testosterone. They're moodier. They have more emotional problems. They're more depressed. So is there a way to give them testosterone and still make sperm? And Dr. Lipschitz from Baylor in 2007 did a great paper as a 3-arm algorithm. He talks about how to treat that. So men who do respond great to testosterone, are there ways to trick the body to make testosterone? Well, your take is you're decreasing your own production, but make sperm. And he has 2 protocols. One is HCG and one is Clomid. I'm going to go Clomid first. So we talk about LH and FSH, tell the testicles to make sperm and testosterone. Clomid blocks that. So by blocking it back to the brain, then the brain goes, oh, I have no estrogen. I got to make those. That's one way to go. But again, I talked about the side effects. Then there's another one called HCG, human chorionic gonadotropin. It's an alpha and a beta. It's a molecule of 2 components, an alpha and a beta. LH in the human body that men have and women have has the same exact alpha as HCG. The beta is different, just a little bit different. This close enough, it could trick the body. If I inject into a woman, I can make her ovulate. Inject her man, you can make sperm. So there's ways to increase our testosterone to pellets, which is a bioidentical marker to get your levels in the previous ranges. Then give your body the shot of HCG. Will trick your body to make sperm while you're on it. His paper has a 70% increased sperm rate.
Probably hard for you to answer, but if you're not on testosterone and let's say your count is 20 million, if you take these 2 medications you're talking about, will you get your count up to 30 million?
Yes, you can. You can. You can do that without being on testosterone, right. Jim. Here's the problem. 4 to 10% of all Americans, again, in that study, have no sperm at all. You can do anything you want to do. You have you don't have any germ cells to make sperm. That's the bigger dilemma. If you're low and can bump it up, it's great. And there are ways. We have a great urologist at our area, Dr. Gadari, specializes in this. You could actually draw, it's painful procedure, but put a needle in the testicle, draw out immature sperm, make a mature sperm outside the body, and then place it that way. We'll call it IVF, part of the IVF. So there's ways to do that. There are more tricks to the trade. It's the sad part is that we need this stuff because what's happening to the environment, these numbers. I mean, just let this sink in. By 2050, MIT and Hebrew University, there'd be no, when they say no, obviously there's something to think through, but these numbers are tremendous. You need a population of at least 2.4, 2.5 to repeat the next generation to come down the pathway. Countries in Europe are negative. We're getting to be negative. That's not healthy for society.
Yeah, I think there's kind of almost a perfect storm right now. You have reduced sperm counts. You also seems like most people are waiting to have kids later in life. Mm-hmm. And then because it's later, they're maybe having 1, maybe 2. And at a minimum, if you're married and you have 2 kids, you're breaking even.
Yep.
And the average family, 30 years ago had, family size was 5 or 6.
Jim, you got 4, I got 7. So we're crazy. But the answer is yes. And that's what is, we talk about, I don't know. I just love human life. I just love life. And I just think it's just a blessing to have that for society. When you watch our children grow, other children grow, I delivered babies for, 30 years. I just love that miracle of life. I get to see little babies from the heartbeat at 5 weeks till I see them come out. It's an amazing event, right? And that's becoming less and less and less. And then when they are getting pregnant, Jim, the miscarriage rate, 1 out of 2 women have miscarriages. 30% have 2 miscarriages or more. And that's probably environmental as well. The third cause is genetic. Blood clot disorders are a major culprit of that. So there's all these other things. We just think, I'm going to have a baby. It does not that way. And it's, again, dealing with infertility all my years. My wife and I tried 3 years before having children. There's a mental part as well. So, you know how I feel about adoption and all this. There's so many stuff out there for life. But the crux of it right now is society, species as a society, we are getting hammered. And we got to figure out why, because there's a point of no return and we can never get to that point.
And just to go back on what you talked about earlier, you're not seeing the same effects in Africa, for example, or South America. And
No, the studies we're reading is their numbers are saying about the same right now. Why? I don't know. Processed food, walking around, more eating, healthier. I don't know the answer.
Mm-hmm.
I just know that we see it. And this study was a huge study. Again, it was in North America, Australia, New Zealand, Western Europe. And it was the largest series ever done. And you compound that to the ones done in the 40s since World War II, it's an issue. You can't lose half your sperm and say nothing's wrong. You just can't do it.
And real quick, I know you probably can't answer this question per se, but because you're not a fertility doctor, but is the traditional medical community now looking at both sexes when it comes to infertility? They're still focusing on the female?
No, there's both, Jim. It is. Yeah, the strict definition is 45% of the time it's male, 40% of the time it's female, 10% unknown. And there's great doctors in both fields of both men and women doing fertility.
Excellent. Another great clock talk with Dr. Brannon. Thank you.
Thank you.